Perhaps there's nothing more unsettling than sensing the inexplicable changes taking place within your own body. Especially when these changes herald the ominous signs of an impending stroke. But fear not, you don't have to face this journey alone. We've delved into the depths of this subject and are here to guide you in recognizing these signs a staggering 30 days before a potential stroke might strike. Welcome to a video filled with revelations about the 9 warning signs of a stroke, the unbelievable indicators that will be unveiled right here. Life can sometimes be too bustling for us to heed the vital messages our bodies are sending. Therefore, we invite you to pause, tune into your body, and familiarize yourself with these signals. Don't miss out on the opportunity to learn about the precursor signs that you could notice 30 days before a stroke. This isn't just about safeguarding your together health, it's a compassionate act of self-care. Let's explore and share this video, so that everyone around us can seize hold of these precious signs and sustain a life of well-being and happiness. 1. High blood pressure. High blood pressure, often referred to as hypertension, is the most important known risk factor for stroke. Imagine blood pressure as a measure of the force with which your blood gently presses against the walls of your arteries as it circulates through your body, all driven by your heart's rhythm. Normally, we consider blood pressure around 120/80, but if those numbers consistently tip over 140/90, it's a sign of high blood pressure. Now, this condition isn't just about numbers, it's like a gentle reminder that our blood vessels, including those linked to our brain, this means the heart has to work much harder to keep the blood circulation going. Okay, let's talk about how high blood pressure and stroke are kind of like old pals, but not in a good way. See, high blood pressure weakens those vessel walls and can even nudge common heart issues to speed up. It can also make these tiny clots or plaques break off and end up blocking blood flow to the brain, not good news. Remember, the higher the blood pressure, the higher the risk of stroke, so it's like a call to action to keep those numbers in check. So, why does high blood pressure even show up at our door? Well, it's a bit of a tricky one. It doesn't often have a single cause, but rather a mix of things. Things like family history, getting a bit older, age plays a role, and even factors like weight, drinking, smoking, diabetes, and that salty diet we sometimes enjoy, all contribute. But don't worry, we've got some power over this situation. Monitoring and managing blood pressure is key. Regular chats with your doc to keep tabs on those numbers are like a health-savvy check-in. And guess what? Lifestyle changes play a big role too. Think regular workouts and keeping a healthy weight, those simple steps can work wonders for your blood pressure. 2. Fatigue. Fatigue, the feeling of constant tiredness, can actually be a surprising hint that a stroke might be lurking around the corner. It's like a quiet signal that deserves a closer look. Peeling back the layers, we find some interesting connections. Fatigue isn't just about feeling tired, it's like your body's way of saying something might be off. And guess what? Lack of sleep is a key player here, putting extra stress on your body's delicate balance. Stress itself is another character in this story, silently affecting your well-being. To make things more complex, an unbalanced diet can enter the stage, throwing off your body's harmony and potentially increasing the chances of a stroke. 3. Vision problems. Vision issues can actually give us some important hints about potential strokes. They're like the body's way of raising a flag, telling us that blood flow to the brain might not be going as smoothly as it should. Now, when it comes to vision troubles, there's a range of common concerns that we should pay attention to. Blurriness, seeing double, or even experiencing partial or complete loss of vision in one or both eyes are all part of this warning system. These are like little clues our body is giving us. 4. Sudden headaches. Those sudden, intense headaches? They're like the body's way of waving a flag, especially if they bring along some other symptoms. Now, headaches come in all shapes and sizes, and it's worth understanding their origins. There's tension, there are migraines, and then there's the classic sinusitis, all part of the headache family. But here's the thing, when it comes to severe headaches and strokes, there's a connection we shouldn't ignore. If your head is pounding and you've got some other symptoms hanging around, it's like your body sending a message in code. By putting these pieces together, we can act quickly and maybe even lessen the risk of a stroke. So, let's give these signals the attention they deserve and keep ourselves on the healthy track. 5. Numbness or weakness in limbs. Feeling numb or having weakness in your face, arms, or legs isn't just a passing sensation, especially when we're talking about strokes. Let's break down the possibilities behind these sensations. We've got pinched nerves, arthritis, and even carpal tunnel syndrome. They're like the usual suspects causing numbness or weakness. When it comes to numbness or weakness in strokes, there's a connection we need to understand. Think of it as your body sending out clues that we shouldn't overlook. If you notice these feelings, especially if they're teaming up with other signs, it's like a call to take action. 6. Difficulty speaking. When it comes to strokes, struggling with speaking isn't something to take lightly. It's like your body's way of signaling that there might be something up with your brain. Stuttering, slurring your words, and having trouble finding the right words, they're all pieces of the puzzle. It's like your brain and tongue are trying to sync up. Grasping the connection between speech problems and the risk of stroke is vital. Consider your body's way of conveying messages that we ought to pay heed to. If you're encountering such challenges, particularly if they coincide with other warning signs, it's akin to a gentle push to respond proactively. 7. Memory problems. For many people, the inability to remember everything clearly is just another sign of aging. Although this might seem normal on the surface, recent research indicates that memory loss can be a precursor to a stroke. A recent study conducted by Erasmus University Rotterdam has delved into the significance of memory lapses as potential indicators of other underlying health issues. The findings, which were published in the journal Stroke, reveal a noteworthy association between memory loss and an increased risk of stroke, particularly among individuals with a higher level of education. While earlier research has highlighted the possibility of stroke leading to memory impairments, this study took a novel approach by investigating whether cognitive difficulties could serve as precursors to strokes. The results indicated that individuals with a higher level of education who reported experiencing memory lapses faced a 39% higher likelihood of suffering a stroke. Notably, this group consisted of individuals with college degrees or equivalent advanced vocational education. 8. Loss of balance. Loss of balance serves as a significant indicator of a potential stroke, primarily due to its implication of damage to the brain's coordination center. This coordination center, situated within the brain, is responsible for harmonizing various sensory inputs and motor outputs, ensuring smooth and precise movements. When this center is compromised, it can result in a loss of equilibrium and balance. Several factors contribute to the loss of balance, including inner ear problems, muscle weakness, and medication side effects. Inner ear problems, such as vestibular disorders, can disrupt the signals sent to the brain regarding spatial orientation and motion, directly impacting one's sense of balance. Muscle weakness, often arising from various underlying health conditions, affects the body's ability to maintain stability and respond effectively to changes in position. Additionally, certain medications can introduce side effects that compromise balance. These effects might include dizziness, drowsiness, or changes in blood pressure, all of which can increase the risk of falling and losing balance. It's important to note that these causes are not mutually exclusive, rather, they can interact and exacerbate the risk of imbalance. 9. Nausea and vomiting. Nausea and vomiting can indeed serve as warning signs of an impending stroke, primarily due to their association with a disruption of blood flow to the brain. The brain relies on a constant and well-regulated supply of oxygen and nutrients delivered through the bloodstream. When this blood flow is compromised, as is the case in a stroke, it can lead to various neurological symptoms, including nausea and vomiting. Nausea and vomiting result from the brain's response to the altered blood flow and the subsequent impact on its functioning. The brain's intricate control over bodily functions, including the digestive system, can be disrupted when its blood supply is compromised. This disruption can trigger the body's nausea and vomiting reflexes as the brain attempts to restore equilibrium. Several factors can cause nausea and vomiting, and it's important to consider the underlying causes in the context of stroke. While nausea and vomiting can indeed indicate an impending stroke, they are not exclusive indicators and can also arise from other conditions. For instance, food poisoning can irritate the stomach lining and trigger these symptoms. Viral infections, especially those affecting the gastrointestinal tract, can lead to similar reactions as the body attempts to expel the invading pathogens. Motion sickness, caused by conflicting signals from the eyes and the inner ear, can also induce nausea and vomiting. Currently, there exists no empirical substantiation proposing the presence of precursory indicators months ahead of a stroke occurrence. Nonetheless, a multitude of risk factors do exist which can significantly elevate the probability of a stroke materializing. These encompass elevated blood pressure, tobacco usage, diabetes, heightened cholesterol levels, and cardiac ailments. Vigilant management of these risk factors coupled with the cultivation of a health-conscious lifestyle holds paramount importance in diminishing the susceptibility to experiencing a stroke. Furthermore, in cases where sudden and intense symptoms arise, like speech difficulties, abrupt facial, arm, or leg numbness or weakness, or an intense headache, swift medical attention becomes imperative. These manifestations potentially signal the onset of a stroke and necessitate immediate medical intervention. Thank you for taking the time to watch the informational video we've shared. If you find this information helpful, please consider sharing it with your friends and loved ones so they can benefit from valuable insights on stroke prevention. Don't forget to like and subscribe to our channel to be among the first to receive valuable health and nutrition videos. As always, we wish you good health, safety, prosperity, and happiness.